Hello, I'm Dr. Deborah Wilson, a board certified geriatrician. I specialize in caring for adults over the age of 60. In today's video, I want to talk with you about something very important yet often overlooked: medications that can quietly damage your kidneys over time. I use the word quietly very intentionally. In many cases, kidney function declines without pain, without clear symptoms, and without any obvious warning signs. Um, Many people only discover there's a problem when routine blood work shows that their kidney numbers have changed. In my practice, one of the first things I review when I see an older adult is this: are any of the medications you're taking placing unnecessary stress on your kidneys? What's important to understand is that many medications that affect the kidneys are not considered dangerous drugs. In fact, several of them are extremely common. Some are available over the counter without a prescription. So, my goal today is not to alarm you, it is to educate you. By the end of this video, you will understand how kidney function naturally changes as we age in, why adults over 60 are more vulnerable to medication related kidney injury, which categories of medications require special caution, and most importantly, how to use medications more safely. Before we go through specific drug categories, we need to understand something foundational. Why do kidneys become more vulnerable after 60? When we are younger, our kidneys have a strong functional reserve. They are very efficient at filtering waste, balancing fluids, regulating electrolytes, and processing medications. However, starting around age 40, kidney filtration gradually declines. This is part of normal aging. By the time many people reach their late 60s or 70s, kidney filtration capacity may be 30 to 40% lower than it was in early adulthood, even if there is no diagnosed kidney disease. What does that mean in practical terms? It means medications may stay in your system longer. Your kidneys are more sensitive to dehydration. Blood pressure fluctuations affect kidney circulation more strongly. And the combination of multiple medications can have a greater impact. In addition, many adults over 60 are living with chronic conditions such as high blood pressure, diabetes, heart disease, vascular disease. Each of these conditions can further reduce the kidney's ability to tolerate stress. So the same medication at the same dose that may be perfectly safe at age 35 can behave very differently at age 70. That distinction is extremely important. A common misunderstanding: many people assume if a medication is widely used or if my doctor prescribed it, it must be completely safe. Let me clarify this carefully. A medication can be safe in one context and risky in another. Safety depends on your age, your current kidney function, your hydration status, other medications you're taking on, and your underlying medical conditions. In geriatrics, we don't simply ask, is this a good medication? We ask, is this medication still appropriate for this person's body right now? That is a very different question. How do medications harm the kidneys? There are three main mechanisms. First, some medications reduce blood flow to the kidneys. Kidneys rely on steady circulation. When blood flow drops, filtration declines. Second, certain drugs can cause direct toxicity to kidney cells. This may trigger inflammation or structural injury in the filtering units. Third, some medications disrupt fluid and electrolyte balance. In older adults, especially those who become mildly dehydrated, this can lead to acute kidney stress. What makes this challenging is that kidney injury often develops gradually. There may be no back pain, no burning with urination, no clear symptom at all. The only early sign may be a change in laboratory values, such as a rise in creatinine or a decline in estimated GFR. And once kidney function declines significantly, some of that loss may not fully reverse. Who should pay close attention? If you fall into any of these categories, I encourage you to listen closely to the rest of this discussion. you are over age 60, you have high blood pressure, you have diabetes, you've ever been told your kidney numbers are a little off, or you take 5 or more medications daily. In the next section, I will walk you through the most common categories of medications that can place stress on the kidneys in older adults. Some of them may already be in your medicine cabinet. And I will not only explain the risks, I will also discuss when these medications may still be appropriate, when caution is necessary, and what conversations you should have with your healthcare provider. Let's begin with one of the most common medication categories in the United States and one of the most frequent causes of preventable kidney stress in older adults. One, NSAIDs, common pain relievers that reduce kidney blood flow. NSAIDs stands for nonsteroidal anti-inflammatory drugs. These include ibuprofen, Advil, Motrin, naproxen, Aleve, and prescription strength anti-inflammatory medications. These drugs are widely used for arthritis, back pain, joint pain, headaches, muscle aches. They are effective pain relievers. And for many people, they are very helpful. But here is what is important to understand. Your kidneys rely on a steady flow of blood in order to filter waste properly. NSAIDs work by blocking certain enzymes involved in inflammation, but those same enzymes also help maintain blood flow to the kidneys. In younger adults with strong kidney reserve, this is usually tolerated without difficulty. However, in adults over 60, especially those with high blood pressure, diabetes, or mild chronic kidney disease, NSAIDs can significantly reduce blood flow into the kidneys. When that happens, filtration drops. Sometimes this leads to a slow, gradual decline in kidney function. Other times, particularly during illness or dehydration, it can trigger acute kidney injury. What makes this especially concerning is that NSAIDs are available over the counter. Many people assume that because they are easily accessible, they are harmless. But regular or long-term use, particularly daily use, can quietly strain the kidneys. This risk increases further if you take them daily for arthritis, you use higher doses, you become dehydrated, or you combine them with certain blood pressure medications, which brings us to the next important category. 2 blood pressure medications, usually protective, but context matters. Now, I want to be very clear. Many blood pressure medications actually protect the kidneys, especially in people with diabetes or hypertension. 2 important classes include ACE inhibitors, such as lisinopril, ARBs, such as losartan. These medications are often beneficial and are commonly prescribed for good reason. However, they work by slightly altering the way blood flows in and out of the kidney's filtering units. In stable conditions, this is helpful and protective, but during times of dehydration, such as vomiting, diarrhea, fever, poor fluid intake, or prolonged heat exposure, the kidneys may already be receiving less blood flow. If ACE inhibitors or ARBs are continued during significant dehydration, kidney filtration can drop further. This does not mean these medications are bad. It means they must be managed thoughtfully, especially during illness. Many physicians recommend what we call a sick day plan for certain patients, temporarily holding specific medications during episodes of significant dehydration to protect kidney function. This is something worth discussing with your healthcare provider if you have chronic kidney disease or are on multiple medications. 3, diuretics, helpful but can increase dehydration risk. Diuretics, sometimes called water pills, are commonly prescribed for high blood pressure, heart failure, swelling in the legs. Examples include hydrochlorothiazide, furosemide, Lasix. These medications help your body eliminate excess fluid. However, If fluid loss becomes excessive, especially during hot weather or illness, dehydration can occur. When dehydration develops, kidney blood flow declines. And when that happens in combination with NSAIDs or ACE inhibitors, the stress on the kidneys can multiply. 4. The triple whammy, a common but risky combination. In geriatric medicine, we pay close attention to something informally called the triple whammy. This refers to the combination of 1, an NSAID, 2, an ACE inhibitor or ARB, 3, a diuretic. Each of these medications affects kidney blood flow in a different way. Individually, they may be appropriate, but when all three are used together, particularly in an older adult, the kidneys can struggle to maintain adequate filtration. If dehydration occurs on top of that, the risk of acute kidney injury rises significantly. I have seen many cases where a patient was stable for years, then developed the flu or a gastrointestinal illness, became mildly dehydrated, continued all medications as usual, and experienced a sudden decline in kidney function. Often, kidney numbers improve once medications are adjusted and fluids are restored, but not always completely. This is why awareness matters. Important clarification. I want to emphasize something very clearly. I am not suggesting that you stop these medications on your own. Many of them are essential and life-saving. What I am suggesting is this. Be cautious with regular NSAID use. Avoid daily use unless your doctor is monitoring kidney function. Stay well hydrated. And ask your healthcare provider whether you should have a sick day medication plan. These are thoughtful, proactive steps, not panic-driven ones. In the next section, we will move beyond pain relievers and blood pressure medications and discuss certain acid reflux medications, common diabetes drugs, imaging contrast dyes, and several antibiotics that can directly affect kidney cells. Some of these may surprise you. We discussed pain relievers, blood pressure medications, and the combination that can place significant stress on the kidneys. Now, I'd like to move into several additional categories of medications and medical exposures that are especially relevant for adults over 60. Some of these are commonly prescribed, others are used occasionally but carry important considerations. 5. Proton pump inhibitors, PPIs, acid reflux medications. Let's begin with a class of medications that many older adults take daily for years. Proton pump inhibitors, often called PPIs. Common examples include omeprazole, Prilosec, pantoprazole, Protonix, esomeprazole, Nexium. These medications reduce stomach acid and are used to treat chronic heartburn, GERD, stomach ulcers, Barrett's esophagus. For many people, PPIs are very effective and appropriate. However, over the past decade, research has suggested a possible association between long-term PPI use and chronic kidney disease. The mechanism is not entirely understood, but in some individuals, PPIs appear to trigger a condition called interstitial nephritis, a type of inflammation in the kidney tissue. This inflammation can sometimes occur quietly, without obvious symptoms, and may only be detected through blood work. Now, I want to be careful here. Not everyone who takes a PPI will develop kidney problems. In fact, most people do not. But what concerns geriatric physicians is prolonged unnecessary use. Many adults begin PPIs for short-term issues such as a stomach ulcer or temporary reflux and then remain on them for years without reevaluation. So the question to ask is not, are PPIs dangerous? The better question is, do I still need this medication long-term? For some people, the answer is yes. For others, a lower dose or an alternative approach may be possible. That conversation is worth having. 6. Certain diabetes medications monitoring is essential. Diabetes itself is one of the leading causes of chronic kidney disease in the United States. So when someone has diabetes, we are already paying close attention to kidney function. Many diabetes medications are safe and appropriate, and some actually help protect the kidneys. However, kidney function affects how certain diabetes drugs are processed. One example is metformin. Metformin is widely used and generally safe, but in people with significantly reduced kidney function, it may accumulate in the body. For this reason, healthcare providers routinely monitor kidney function and adjust dosing accordingly. Another category includes certain newer diabetes medications that may require dose adjustments depending on kidney filtration rates. The key point here is not that diabetes medications are harmful, but that kidney numbers must be monitored regularly, especially after age 60. If you have diabetes, it is appropriate to ask, when was my last kidney function test, and is my medication dosing still appropriate? 7. Imaging contrast dyes, temporary but important risk. Another situation that can affect kidney function is exposure to contrast dye used in imaging studies. For example, CT scans with contrast. Certain cardiac catheterization procedures, the contrast material used in these procedures can, in some cases, temporarily reduce kidney function. In younger, healthy individuals, this is often well tolerated. But in older adults, particularly those with diabetes, pre-existing kidney disease, heart failure, or dehydration, contrast exposure can trigger acute kidney injury. For this reason, physicians often check kidney function before administering contrast, ensure adequate hydration, and in some cases, adjust medications temporarily. If you are scheduled for a contrast-enhanced imaging study, it is reasonable to ask, have my kidney numbers been checked recently? That is a thoughtful and appropriate question. 8. Certain antibiotics, direct kidney effects. Finally, let's discuss antibiotics. Most antibiotics are safe when prescribed appropriately. However, certain types are known to have potential kidney effects. Examples include aminoglycosides used more commonly in hospital settings, high-dose vancomycin, certain antiviral medications, and in some cases, long-term use of medications like trimethoprim sulfamethoxazole. These drugs can sometimes cause direct toxicity to kidney cells or alter electrolyte balance. In outpatient settings, this risk is usually monitored carefully through lab testing. But in older adults, particularly those who are hospitalized or treated for severe infections, kidney function must be observed closely during antibiotic therapy. It is also important to understand that infection itself can stress the kidneys. So sometimes kidney numbers change because of the illness, not solely because of the medication. Again, context matters, a pattern you may notice. Across all these examples, a pattern emerges. The medications themselves are not inherently bad. The issue is age-related kidney vulnerability, dehydration, polypharmacy, taking multiple medications at once, and lack of periodic reassessment. Many kidney-related medication problems occur not because a drug was inappropriate at the start, but because it was never reevaluated as the body changed. And our bodies do change. In the final section, we will bring all of this together. We will discuss who should be most proactive about medication review, warning signs that warrant attention, practical steps you can take to protect your kidneys, and how to approach medication conversations with your healthcare provider calmly and constructively. We've discussed several categories of medications and medical exposures that can affect kidney function, particularly in adults over 60. Now, let's bring this together in a practical and reassuring way. The goal is not to fear medications. The goal is to use them wisely. Who should be especially proactive? If you are over 60, kidney awareness is important, but it becomes especially important if you have high blood pressure, have diabetes, have heart disease, have ever been told your kidney numbers are borderline? Take 5 or more medications daily, or have been hospitalized in the past year. These factors increase the likelihood that your kidneys are already working with reduced reserve. That does not mean your kidneys are failing. It means they may not tolerate stress as easily as they once did. And awareness allows you to prevent avoidable harm. Are there warning signs of kidney stress? Sometimes there are, often there are not. Early kidney decline is frequently silent. However, certain symptoms should prompt medical attention. Sudden decrease in urination, swelling in the legs or around the eyes, unexplained fatigue, persistent nausea, confusion during illness, or dizziness accompanied by dehydration. But I want to emphasize again, many people feel completely normal even when kidney function begins to decline. That is why routine blood testing matters. For most adults over 60, especially those on multiple medications, kidney function should be checked at least once a year, and sometimes more often. Practical steps to protect your kidneys. Let me outline clear, calm, practical steps you can take. 1, review your medication list regularly, at least once a year. Ask your healthcare provider, can we review all of my medications and confirm that each one is still necessary? Bring prescription medications, over-the-counter pain relievers, supplements, herbal products. Many kidney issues arise from over-the-counter NSAIDs that were never mentioned during appointments. Transparency is important. 2, be careful with regular NSAID use. If you take ibuprofen or naproxen frequently for arthritis or chronic pain, ask, is this safe for my kidneys long term? There may be alternative pain management strategies such as acetaminophen in appropriate doses, physical therapy, topical anti-inflammatory gels, targeted injections, or other non-NSAID options. The goal is not to eliminate pain treatment, it is to balance relief with safety. 3, stay well hydrated. Dehydration is one of the most common triggers of sudden kidney decline in older adults. This becomes especially important during hot weather, travel, illness, fever, vomiting, or diarrhea. If you become ill and are unable to maintain fluid intake, contact your healthcare provider. In some cases, temporary medication adjustments may be appropriate. 4, ask about a sick day plan. If you take medications such as ACE inhibitors, ARBs, diuretics, certain diabetes medications, it is reasonable to ask, if I develop vomiting, diarrhea, or significant dehydration, should I temporarily hold any of my medications? Many physicians support this proactive strategy for patients with kidney vulnerability. 5, monitor kidney function after major changes. Kidney numbers should be checked after starting certain blood pressure medications, after contrast imaging, after hospitalization, or after significant illness. If labs have not been checked in over a year and you are on multiple medications, it is reasonable to ask for updated testing. A calm perspective. I want to close with an important reassurance. Medications are not the enemy. Many medications extend life, reduce complications, protect the heart, and improve quality of life. The issue is not medication itself. The issue is that our bodies change as we age, and medication regimens must evolve accordingly. In geriatrics, we focus on what we call risk-benefit balance. At age 40, a medication may carry minimal risk. At age 75, the same medication may require more careful monitoring. That is not failure. That is physiology. The most important takeaway. If you remember only one thing from this discussion, let it be this. Do not stop medications on your own. Do not panic about what you're taking. Instead, be informed, be curious, and ask thoughtful questions. Kidney protection is rarely about dramatic action. It is about small, consistent decisions, hydration, monitoring, and periodic medication review. That is how we preserve function over time. Thank you for taking the time to learn about this important topic. Your kidneys work quietly every day, and with careful attention, they can continue to serve you well for many years.